The race for mayor of Boston has expanded with the announcement this week by a fourth candidate who joins us tonight. Along with being a state representative from the South End, he's a physician at Boston Medical Center and vice chair of a legislative committee on the pandemic and emergency preparedness. We'd like to welcome Jon Santiago. Thank you very much for being with us, Jon.
Thanks for having me on, Chris. Good to see you again.
Yeah, and good to see you again as well. I know because you've been working at Boston Medical Center all these years, you're no stranger to crisis, but looking back over the past year, how has that changed your sense of mission and what that means to becoming mayor of Boston?
Well, it's definitely added a level of urgency. And, when there's a crisis, I'm the type of guy who's always trying to jump in to see what I can do to help out, whether that's in the emergency room. Do we need another pair of hands to help out establishing an IV line, bringing in medication, or whether now in the role of government, in my position as a state representative. During the first surge, I think that took us all by surprise, and many of us were concerned and had no idea how this pandemic was unfolding in Boston and in our hospitals. And during that time, I actually doubled my hours in the emergency room. I went from working every other week to working every week and working the entire surge. But I doubled down on my commitment at the State House in terms of my work there and being part of the COVID-19 advisory group that Speaker DeLeo created in order to address COVID-19 within the House of Representatives and to put policies in place that would allow us to continue to operate. And I very much look at this mayor's race in a similar light. We have a pandemic that has completely upended society as we know it, our healthcare system, our economy, our schools. And so I'm running for mayor really to bring Boston back stronger than ever, to lead us through that crisis into a recovery very much rooted in equity and opportunity.
Well, if you were mayor right now, I imagine you'd be pretty tightly focused on what's going wrong with the vaccine distribution. And I know the supply is limited, but within the limited powers of the city, what should a mayor be doing right now?
Well, I think the focus of any vaccine rollout has to be on equity as well. It can't just be a numbers game with respect to doses received and doses administered. We really have to make sure that equity is the foundation of this. And so while it may be easier to put all the vaccines at these large mass vaccination sites, make your numbers look well, the question is, what about those communities that have been hardest hit by the virus? What about the elderly that can't drive to the Fenway or to Gillette? Making sure those folks have access to vaccine would be a priority of mine. And it has been. And I think that's what we've been doing in the State House, really pushing the governor to move in that direction. And so tomorrow, on Thursday, we'll be having an oversight hearing to really get down and to see why the vaccination rollout has been as bumpy as it's been, and just to make sure that those communities hardest hit by the virus, whether they be Black or brown or elderly or certain parts of the state, haven't had the same access.
What about the reopening of schools and particularly what the governor wants to see? A full-time reopening all the way through grade 12 by April 1st. Is that realistic?
Well, it's a very challenging situation. There's no doubt that, I want to see children get to school as soon as possible. We are seeing, even in my experience as an emergency room physician, the mental health crisis has completely taken off. Where I work in the emergency room, we have a specific section dedicated to psychiatric mental health cases. And if I were to go in the emergency room right now, the number of patients who are waiting to be seen or waiting for a bed to open up across the city or state is dwindled down in terms of limit, and people are just waiting in the emergency department. So I think we need to get children back to school as soon as possible. And we do that by making sure that teachers and staff feel safe, secure, and comfortable in returning to school. And that's by vaccinating them. And so as soon as we have the supply, we need to make sure that we're prioritizing teachers in a way that, because of their work, because of the nature of the schools, because of the needs to get kids back into school, that they're vaccinated as soon as possible on their staff.
Of course, in your district as a state representative, you also include the intersection of Mass Ave and Cass Boulevard. It's been a problem area for a number of years, and especially since 2014 when access was lost to Long Island. But where do we go from here? What needs to be done? Because it's going to be a long while before that bridge is up again to Long Island.
That's exactly right, Chris. And I think it's not just about whether a bridge is built or not built. Yes, I do believe a bridge needs to be built. I do believe establishing a recovery campus on Long Island is the way to go. But the problem is a lot more complicated than sometimes we give it credit for. I live a block away from Mass Ave. I walk down Mass Ave when I go to work in the emergency department. I treat patients at the epicenter of the opioid crisis there at Mass Ave. These are my patients. These are my neighbors. And so I have an understanding of the process or the issues from not just a residential perspective, but that as a healthcare worker and that as a policymaker. One of the reasons why I ran for office in the first place was to help address the situation. And I'm proud that over my time on Beacon Hill that we've been able to bring some resources to City Hall to address the problem. But what we've come to know is that it's not just a number of dollars that are going to save and address the situation. We really have to be innovative in how we kind of begin to decentralize the process or the services there. I mean, we have 3 of the largest shelters there. We have a whole host of different healthcare providers. And listen, as a provider there myself who treats and cares for these patients, the situation down there has gotten to a point where it's not sustainable. I mean, there is sex trafficking, there is violence. I mean, enough is enough from the neighbors. And so we need to make sure that we're partnering with not just different neighborhoods, but different cities and towns all across the Commonwealth to make sure folks are getting care in their respective areas. And as a legislator who has relationships with the legislature and with the governor, I feel that I'm best positioned to address the issue at Mass and Cass.
As you point out in your announcement video, one of the other concerns is rising rents because there's a rising cost of housing. In the legislature, I think you were not receptive to increasing the ability of local communities to increase rent control or some kind of regulation, and maybe has some qualms about expanding inclusionary zoning too. So if those are not the answer, what would be better as far as easing the housing crunch?
Well, I think, we're in the midst of this campaign right now. We're on day 2. And over the course of the next couple of weeks, we're putting together a platform to really look into housing. Without a doubt, when I speak at my neighborhood, when I go around the city over the past 2 weeks, gauging interest in certain ideas or policy platforms, my intention is to really come up with a thoughtful platform that engages stakeholders all across the board here. And that's what we intend to do. And so this week, we are announcing our candidacy. But over the course of the next couple of weeks, we'll be putting on a platform to address the issue because, listen, there's a large segment of Boston, people here in certain neighborhoods who felt left out of the process, who felt like they have to move out of the city. I mean, I saw this as a state representative candidate in my neighborhood, the South End, a place that many would argue has been gentrified over the past 3 or 4 decades. And so this is a big concern of mine. And so I think, I'm proud of the fact that over the last legislative cycle, that there was some zoning reform across the state. I mean, Boston and Cambridge can't, build all the new units for tomorrow. And so we're looking forward to having a discussion with the residents of Boston.
Of course, another question is about the school system, because just before the pandemic really hit in Boston, we had this report from the state about the Boston public schools and really just sort of raising the likelihood of state intervention because of the underperformance. What would you like to see done?
Well, I'm very proud of the fact that when I ran for office the first time at the legislative level, that I ran on a platform to pass some sort of education reform. And, I think it was widely extolled from all sectors. The Student Opportunity Act brought funds all across the state to really address the disparity issue in education. And look, in Boston, we have a system that many would argue is struggling. I am a Latino kid who spent a number of years growing up in that system, where 70% of the students are low income, 42% are Latino. I mean, I see myself in many of those children, and I see the challenge that they're facing. And right now, I think the priority has to be addressing the COVID-19 context right now, making sure kids get back to school as soon as possible, because we know that hybrid and remote learning is not the same as in-person learning. So as soon as we can get folks back to school and address the acute crisis right now, I want to have a bigger discussion how we begin to address our school system in Massachusetts to make sure that, in Boston rather, to make sure it's, really the cream of the crop.
As you noted in your announcement, there are places where you're seeing hope. It might be hard to find in an emergency room or on Mass and Cass, but where do you see hope?
I see hope every day when I speak with people. I mean, the emergency department is a very challenging environment to work in. We see trauma, we see death, but we see an incredible amount of resilience and love for one another. And I think what I'm seeing already in my last 2 weeks and having conversations across the city is that despite the differences certain neighborhoods may have with one another, I mean, West Roxbury is not Roxbury, Southie is not JP, but we have a lot more in common than we don't. And that's what gives me hope. I think people are looking for a practical servant leader really to guide this city to recovery, very much rooted in equity and opportunity. And I think I bring that to the table.
Just one of the other things you bring to the table is your own life story. You mentioned you're a Latino student in Boston, part of your life when you were growing up. You know, given so many students, disadvantaged students, that they have worse outcomes, why was yours better?
You know, there's a lot of factors that play into that. You know, I work hard. There's no doubt that work ethic was a part of it, but there's no part that luck was a part of it as well. And I feel very lucky that I've been blessed with a number of role models that have been able to kind of, provide an opportunity. But no, so many kids in Boston don't have that. I mean, there's so much potential. There's a lot of a lot of students who have a tremendous amount of work ethic, but they just don't have the opportunity. I see myself as a person who can help provide those opportunities. When I think about what the 21st century Boston economy looks like, what a thriving biotech life science sector could do in Boston, in terms of not just building the industry of tomorrow or the vaccines for the next pandemic, but really providing an opportunity for K through 12 students to get involved and engage UMass Boston students as well. I mean, Chris, if I'm honest with you, I mean, if it wasn't for a 5-week summer program I did when I was 19 years old, that plucked, minority children who had an interest in science and engaged with them for 5 weeks, saying, "Listen, you could be a scientist, you could be a physician. I would not be a physician here today." And I think, what excites me about this mayor's run is the synergy between economic development, science, and education, and allowing these students to partake in that economy is something that I'd be thrilled to run and to engage and to really bring to Boston.
Well, thank you very much for joining us and sharing the story.
But thanks, Chris. Looking forward to coming back on.
Good to see you again. State Representative Jon Santiago, candidate for mayor of Boston. We'll have more news in just a moment.